In the heart of Upper East region of Ghana, an inspiring journey unfolds. For over a decade, a non-governmental organization, Participatory Action for Rural Development Alternatives, or PADA, has been at the forefront of a transformative mission, promoting maternal and child health, resulting in zero mortality rates. Since its inception in 2005, PADA has been dedicated to empowering communities through participatory health strategies. Their mission: improved integral human well-being and reduction in vulnerabilities in the human society in Ghana.
It is based on the community initiatives that PADA came in as a supplement to augment the efforts of community members. That is how the name Participatory Action for Rural Development Alternatives came about. And that is how we work. We work from bottom up and not from up to bottom. That is the philosophy of PADA for short.
Through initiatives like female-led community health committees and traditional birth attendant training, they have brought about substantial changes. In 2009, PADA initiated a maternal and child health care project covering 12 communities in the Upper East region of Ghana. Supported by Oxfam, this project aimed at reducing maternal deaths, improving healthcare infrastructure, and ensuring equitable access to skilled delivery.
Our mandate is to work with the community based on their needs, and their major and priority needs have always been on maternal, newborn, and child health.
So where women, in an attempt to give life, lose their lives, definitely Oxfam, it will be a source of concern for Oxfam. So the project was implemented in the Upper East region to reduce the maternal mortality ratio in the region to at least the national average or even lower.
Before the inception of PADA project, the number of maternal and child mortality rate in the Upper East region surpassed the national figure. According to the 2010 Population and Housing Census report, Upper East region recorded maternal mortality ratio of 802 per 100,000 live births, higher than the national figure of 485 per 100,000 live births. Therefore, the impact of PADA's maternal and child health care project has been profound. The period of its implementation has seen the project catchment areas recording zero maternal deaths, increased antenatal care attendance, and improved information management systems.
And actually, before their inception, we had a series of challenges. Among them were low attendance to antenatal care. We equally had inadequate privacy to provide health services. Then what I would like to also add is that most of our mothers who were due for delivery, most of them actually came at the stage of unpreparedness. And these were challenges PADA has come to actually help us to address.
The success of the maternal and child health care project is built on effective strategies. Community mobilization, infrastructure improvements, incentives, and collaboration with Ghana Health Service are among the pillars of the approach.
Through PADA initiative, most of the community have been oriented and health workers set up in order to put their house in order so that they will be in a position to render the needed services to help the people.
Usually TBS used to sit at home and conduct home deliveries, but now they have been trained and equipped to support and link these pregnant women to the nearest health facility to get skilled health delivery.
I'm T. Susanna, a TBA in Kwatentabek. We used to conduct delivery in our homes. And anytime a woman is in labor, we have to call a herbalist to come and support. Sometimes we shake the woman, and at the end, they might lose their children or even lose their life. And that way, it wasn't helping. So PADA came and invited TBAs, invited herbalists, and then the soothsayers to come, and they told them about the advantages of delivery in the hospital. Because of the training that we had, we involved the chief about what Pada said and the importance of hospital delivery. So the chief placed an order. Anyone who does not abide by the laws that they have kept to deliver in the hospital will pay a fine. So from that day, anyone that was in labor, I will carry the person to the hospital, and it go to a stage where they themselves personally go to the hospital without me following them to the hospital to deliver.
My name is Charity.
Akintoa Charity. I'm also a health volunteer for the Zoarongo Health Center. Another thing is the teenage pregnancy. When they are pregnant, they hide. But Pada have made us to know that we have to also let them come. So we go and we find out those teenagers that are pregnant. We ensure that we bring them to the facility for also safe antenatal and safe delivery. My name is Asumbo Dorothy. And when I come for the antenatals, we have meetings. So from the meetings, I get to know the importance of attending ANC and the importance of going back to school. So when I deliver, I will go back to school.
A unique flagship innovation under the Maternal and Child Healthcare Project is the Pregnant Man. The Pregnant Man Initiative is a campaign challenging cultural norms and encouraging men to actively support their wives during pregnancy. This cultural shift has been a key strategy in addressing maternal health imbalances in the project's operational communities.
The pregnant man is when your wife is pregnant, you follow her to the facility, go through the processes, and when you come, they attend to you earlier, then you go.
They accompany this pregnant woman to the antenatal service, and through that, they themselves are equally sensitized on what diet, what kind of care these mothers actually need. And because they are there themselves to feel and hear from the service provider, they are able to provide this support when they go back home. And this has actually improved health outcome. It has improved the support for pregnant women, and most of them have come back to give feedback to their caretakers or their midwives that they are actually now getting improved care in their various homes, and health outcome for most of the children that are born through that has actually improved.
As you can see, Mr. Anthony, this is the second wife of Mr. Anthony who have been following the wives to come to the facility, and other males who follow them to come. So they come, and together with the help of professionals, the case is given, and then the man understands.
And we can testify that that initiative, which is our flagship initiative, actually brought down non-attendance to ANC to barely zero within the first year of its implementation.
In relation to the Pregnant Man Initiative is the pregnancy school strategy that is held once every month to properly educate expectant mothers on the do's and don'ts of pregnancy and labor.
And we know most of these pregnant mothers have different level of challenges and different level of experience. So these pregnancy schools are opportunities for them to come and share knowledge and see how best they can support each other.
These schools have caught up, and as we speak, all the health facilities that we have in the Upper East region have adopted the pregnancy schools fully.
Recognizing the importance of infrastructure, Pada constructed pavilions, expanded maternity units, and initiated emergency transport committees to ensure timely access to healthcare facilities. A strategy that immensely encouraged the healthcare givers and beneficiaries is motivation. Pada introduced incentives for healthcare workers, community health committees, and pregnant women. These incentives have not only improved services but also increased community participation.
There was something like encouraging 4th visit, 8th visit to the facility, which is an indicator in Ghana Health Service. So with that one, any pregnant woman who has been able to make 4 visits to the facility continuously without a break, then they were given some items to encourage them to come and deliver at the facilities.
We also provided in terms of incentives, like the rural ambulance service, We provided that. We provided motorbikes to community health officers so that they could reach the innermost parts of the communities to give them health education.
They supported one of our facilities with motorcane ambulance. And we all know that ambulance is very key in referrals.
When Pada came and built the labor room for us, the maternity ward, Sia, Wakia, Tenzugu, Yindori, they are all coming there to deliver. It is now better.
Previously, when a lady is pregnant and she's in labor, we have to travel from Naga here to Navrungu, which is about 37 kilometers. It wasn't an easy journey. Sometimes we have to use bicycle, sometimes motorbikes, and then of late, motorcane. But when Pada came in, they gave us a motorcane, they gave us delivery beds. In fact, it has helped us a lot.
When they came, it was just one room where we're using to palpate, we're using to do consultation, and then with the delivery, we will deliver them. The woman will still sleep in that same room. So when we have two women, you see the other person, seeing the other person's privacy, which was no good. But with Pada empowerment that they gave to our people, and they also provided us the beds in which we used to establish our labor room to be conducting our delivery, our volunteers were able to take those empowerment that they gave as a good initiative to be able to create the line in that we are currently using.
Communities who do not have water, we supply them with boreholes for them to supply water to the delivery rooms. After a woman has delivered, they need to clean, which was a challenge. For example, this is one of the hand pump boreholes that we constructed for the Naga Health Center.
The uptake of these innovations that we mentioned went wild in such a way that our target reach of 2,000, we went as far as 113 plus thousand reach of the community members. And this is very phenomenal. One of the key initiatives that we also did is community empowerment. And that is what we call Community Health Accountability Project, which we tried as much as possible to empower the community members to demand the authorities for their health needs and other needs that they thought that government could provide and they were not providing.
Sakuta to this place is far, Skotentavka to this place is far, but the women themselves can come with their leadership, come to say on behalf of the training and the leadership of Pada who trained them, they have come to seek to find out what they asked for the assembly to come and support, whether it's ready. So I like that. Wow. We sit to attend to them. And we've also through their this, we've supported and we have done a lot. Most of the chiefs from home were not having water, we have done it. Some electricity. Nobody like this, if you go there today, they will say a lot and they don't forget of them. We went there and assisted. Now we are about to get them the lights. But the boreholes we have drilled for them. Finishing up the chase compound, we've done that.
This is an example here in Anatem. This construction is ongoing. This is not a government project. It is the community-owned initiative through our advocacy strategy and the understanding and the community ownership by the Anatem leadership as a result of our training.
The chips compound does not belong to government again. It's for the community. So the community people have to be involved in the development of the chips compound.
Initially, we didn't have a lab. And so when Pada came in with the trainings, and then the fact that the women will have to travel all the way to Bolga to do labs, the community saw it as a need. So they mobilized and then built a lab and even provided some of the logistics.
The implementation of the Maternal and Child Healthcare Initiative, like any other transformative development project, has not been without challenges.
And one of the challenges that we encountered was that many men didn't think that it was necessary for them to provide some other logistics for their wives to go for ANC. Apart from that particular challenge that we got, one of the biggest challenges is sponsorship curtailing. many more activities, especially these innovations, caught up with so many communities that we were not even working in. A lot of them came, but we were incapable of upscaling at the time because we were out of funds and we could not get other sponsors to come in to help us. So we are calling, and 13 districts in Upper East Region, 1 municipality in Northeast Region is not a joke.
They are practical and down to the people. I don't think I will have I've lots of way. If I'm to speak from morning to evening about them, I will say a lot to the whole world. But what I have for those who can support, they are donors, you do well. It's an NGO that actually moves on and uses what is given to them, and they even use their own time.
Now the drive is to get our policy makers to actually appreciate this initiative and to see it as one of the ways to deal with maternal mortality and child mortality, so that by the end of 2030, we would have achieved the goal set up by the Sustainable Development Goals.
With PADA, you have come in to support us in terms of infrastructure, education, and health promotion activities. We want to see more working relationship with you with the coming years. So we will plead with any other development partners that you may source funding from them to continue to give you the needed support in order for us to work together to provide both infrastructure, that the physical infrastructure, and logistics that we need to help to uplift the image of health service in Upper East Region.
As PADA continued to make strides with the maternal and child healthcare initiatives, they share their best practices for adoption. As Ghana strives to achieve the United Nations Sustainable Development Goal 3, reducing maternal mortality and ending preventable deaths of newborns and children by 2030, PADA has already taken the lead with the implementation of the Maternal and Child Healthcare Project, thus showing that it is possible.
You will see that in 2021, the maternal mortality rate or ratio in the Upper East Region had been reduced drastically to about 67 or so per 100,000 live births. Compare that to the 802 that was recorded around 2010. So this is an indication that when you intervene or you implement initiatives that are right, that are correct and appropriate for the people, mortality rates are going to be reduced, not only for mothers but also for children.
Despite the fact that some of the communities the project has come to an end, the community members have owned this initiative, and ANC attendance is still on the ascendancy. And we hope that when these initiatives are upscaled to other districts, to other regions, and the entire country, maternal mortality and child mortality will reduce significantly.
So for the past 5 years, the district has not recorded any maternal death. We had reduced incidence of stillbirths.
Now, as we used to be 8th and 9th at the bottom struggling, out of 15 districts, 2020, we saw that we came to 3rd position in the district, as young as our district is, and it was really marvelous, and we're all very happy, and thumbs up for the support of the PADA NGO.
As a result of all this intervention from the period that PADA came in to support the facility, there was no any maternal death record for the facility and then the district at large.
Through innovation, collaboration, and unwavering dedication, PADA has created a ripple of positive change. As we celebrate these achievements, it is their hope that it will be a blueprint for organizations and health services aiming to improve maternal and child health and also be an inspiration for a future where every mother and child can thrive and reach their full potential.